What I will do is reflect this muscle from its attachment to the zygomatic arch, like so. You can see here that a segment of the mandible has been removed. The section was removed so we can look at the two pterygoid muscles. If we lift this temporalis tendon up and reflect the muscle superiorly, you can see in here the lateral pterygoid muscle. That lateral pterygoid muscle has an attachment to the lateral surface of the lateral pterygoid plate and to a little bit of the sphenoid bone. The fibers pass in a nearly horizontal direction to the condyle, the neck of the mandibular condyle at about this point here. The fibers of what are called the superior head of the lateral pterygoid muscle, and that muscle is frequently divided into an inferior head and a superior head. The fibers of the superior head attach into the disc of the temporomandibular joint, which you can see right in here, although there is no good way to dissect that disc out so that you get an accurate picture of it from a cadaver without using some very special dissecting techniques. There is the temporomandibular joint disc, into which some fibers of that superior head of the lateral pterygoid muscle attach. This is the inferior alveolar nerve that goes into the body of the mandible. This is the lingual nerve that goes to the tongue. These are two of the major sensory branches of the mandibular division of the trigeminal nerve. They are traveling across the medial pterygoid muscle, which arises from the pterygoid fossa between the medial and lateral pterygoid plates. The muscle fibers run inferiorly and attach along the angle of the mandible in a similar position on the medial surface of the angle of the mandible, where the masseter muscles attach on the external surface of the angle of the mandible. A reasonable statement can be made that the superficial positioned masseter muscle and the deep positioned medial pterygoid muscle, those two muscles have a comparable fiber orientation.